Now this is Thaddeus. This is another evangelistic program I was invited to do in Uganda, and we were doing classes in the early afternoon, and this man came in. This wound here is 16 years old. It would heal, scar over, and then he would receive some sort of medication and it would reinfect, and it just heal, scar, infect. And this has been going on for 16 years. His family had totally abandoned him. His children did not want him anymore. He was destitute, his wife and he were in the most decrepit conditions. So somebody brought up, he was watching, and I looked at him and I'm thinking, somebody's going to ask me to do, what do we do with this guy? And I'm thinking, Lord, I have no idea what to do with this guy. And finally, somebody said, well, what about this guy? What about this guy? Bring him up. So he brought him up and we cleaned off his wounds. And I'm standing there praying, God, what do? It wasn't just charcoal we've been talking about. We're talking about aloe vera and some other moringa leaf. And I'm thinking, what do we do with this guy? This is out of my realm. We've done little scratches and poison ivy, but I've not done this before. So finally, we had charcoal, and we cleaned off the wounds. And I'm thinking, how do you treat this? So I got some charcoal powder, not activated charcoal, and I put it in a cup, and I just brought it over the wound, and I just tapped that powder out onto his wound, directly onto it. Just covered the whole area. After I'd covered the entire foot area, rolled his leg over, done it both sides, then I went and made a charcoal poultice, and we applied it over his wound. This guy is a prime candidate for HIV. Everybody's watching me. The woman in blue is a chaplain from the local university. She's from Ghana, and she is focused on what we're doing, and for good reason. Then he would go out in the evening, and we'd dress him, and then he'd go out in the evening to the evening evangelistic program. Now the woman, that's her again over here. This is their poverty. I mean, they just lived in this filth. How do you heal anything in that kind of filth? I don't know, but she went every day faithfully and instructed them how to deal with take off poultices, put on new poultices, and they did that. I think it was for 6 weeks, and here he is. The wound is healed, not scarred over. This time it's healed, it's skinned over. 6 weeks, and he's baptized. He went to the series, and he is a new creature in Christ. A year ago, we were invited to the Liberty and Health Alliance clinic in Greensboro, and one of the nurses brought up her brother who had this infection. We don't think he was diabetic. She said, I don't think he's diabetic. He's never been diagnosed. But the wound was only getting bigger, and the inflammation was up to his knee and down to his ankles, and it was just getting worse. He couldn't sleep. He'd lost his job. He's a truck driver, not the best diet. And I'm thinking, what am I going to do? And into my mind flashed Thaddeus. That's what came into my mind. Thaddeus. Oh yeah, Thaddeus. I said, we can do this. We'll do it. Because somebody came up and said, do you think you could treat this here? And I said, sure, we can treat it, So confident. So we put this poultice that Leanne had made, this giant poultice. We've been making these small ones, a whole bunch of them, to give out. And we put a giant one on him, had a prayer with him. That is 7 days later. Can you see that? 7 days later. That's 14 days later. That's 2 weeks. 2 weeks from there to here. How do you get from there to there? It's more than charcoal, I'll tell you. But God is willing to use the simpler remedies. Why? It's to help us, help our faith. That, you know, God is working. He can use me, a carpenter, a nurse, a doctor. He can use anybody to do this. It's a simple thing. And I'm saying this to you so you're not intimidated when you see some of these very, very aggressive wounds or cases. You're not going to add to the problem, most likely. Day 14. Now here's the guy that we were hoping to introduce to you. Is Carrie. This is day 1 from this June at the Mega Clinic in Asheville.
I met him up there too.
Yeah, this is a result of 14 months, 3 times a week of professional wound care by a wound care doctor in Asheville. The doctor finally said, "I can't help you." And Carrie said, I should let him tell his story, but I hope he makes it. But Carrie said, "I'm giving up on you too. You know, you're not helping me anymore." And there was already discussion about amputating both legs. So I have pictures now from before this, and he was in bad shape. And as it would be, there was a clinic already pre-clinic to the Mega Clinic, and some people had already befriended him, and he did not want to go see another doctor. He was anti-doctor at that point, and he did not want to be seen by anybody because he smelled so bad. He was told to leave restaurants. He was kicked off of buses because the odor was profound. And I took one look at his leg and I thought, this is beyond me. You know, you guys brought him in, and I thought, well, you'd said, well, this is bad. And I said, well, and I showed you a picture. Well, this is worse. And I'm thinking, oh no, what am I going to do? And they, sure enough, I thought, well, maybe he doesn't want to come. You know, he was very, very, he was very self-conscious about this odor. I would have been too. So Dr. John Colley happened to be there. And we thought, well, he's going to go on to the medical staff. They're going to address his wounds, and then he's going to be covered, and we can't take the dressings off. Dr. John said, let's do it here. And so, thank you. So he said, let's do it right now. So I went ahead and I cut the dressing off the one leg, the left leg. I thought I was going to pass out or gag. The odor was so bad. And we didn't have gloves on. We went ahead and made up some bandages, put them on, made the charcoal poultices, larger ones, got them on him, and he had the nice pinkest legs in the whole place by the time we were done. Well, that's horse wrap, and he had one small infection on his knee. And there's a lot to his story. There's far more than I can tell you this afternoon. This is 24 hours later. You can't really appreciate this, but when I took the wound dressing off, everything came off. All the dead skin came off. Everything had turned to mush. The poultice had turned to mush, and I just kind of peeled it all off together, and it was a pile of mush on the floor. I would say 50% of the odor was gone. Yeah.
I just want to say too that during his regular dressings before this charcoal treatment, because I'm a friend of Carrie's, the bandages the doctors and stuff had put on were useless. There was so much drainage off of this. His shoes were soaking wet from the stench of the stuff coming off of this.
Yes. There's no sense wearing socks because they just filled up immediately. But I'm not sure if you can just see it, but right along the edge, there's virtually no inflammation now, and there's a very thin sliver line of white pink tissue. What's that?
Regrowth.
That's regrowth in less than 24 hours. Now, for that to happen, the infection had to be stopped so that the growth could happen. Now I'm going to come back to my skill testing question. Do bacteria have teeth? Everybody's not really sure about this one. I don't blame you, because I pondered this one for a long time. How big are most bacteria? Single cell, right? How big is a single cell? Smaller than small. So Carrie said, well, something's eating my leg. It must have teeth. So when I asked them, do they have teeth? Well, look at them. Something's eating them. And I said, they don't have teeth. So how does the bacteria do that? How does it do it? What did that one CDC director say? Or that specialist? The toxins from the microbes. Ellen White said the poison of inflammation. These microbes produce toxins, exotoxins, and guess what they do? They dissolve flesh, and then they can assimilate their food. You know, it's like heavy-duty saliva. It chews into the food. Well, guess what? Ellen White said it neutralizes the poison of. Where's the poison coming from? The microbes. It neutralizes the poison, and what? The poison is eliminated, and then what? The patient slept, the pain is gone, and the healing went on. This is less than 24 hours later, he's slept. A good bit of his pain is gone, and he's somewhat lucid. He was under the influence. For his pain, he's been on fentanyl for a long time. And so that's another whole layer to this thing. And Jack will maybe relate some of that later. If he doesn't come tomorrow, we'll just flesh out this story a bit more. Oh, who's that? Say?
He's free of any drugs now.
He is. That's another story. But, oh look, up there's a medical missionary.
Yes.
A wannabe medical missionary. He's paying attention. You know, he's observing. Can you see it a little bit better? This is day 2. It's very hard, you know, it's a hard sell, and you can hardly blame Carrie for not wanting to do this, but, you know, in less than 24 hours, he's sold. And that's the miracle part. That's where God touches, you know. It's not just charcoal happening here, but he was willing to try. We were willing to try, and because we were all willing, God said, I'm willing. You're going to try this my way, I'm willing to help. And he did help. And this is just the beginning of the story. I mean, now the second day, I looked at his wounds and I thought, well, they're looking better, but I know for a fact that when I leave, nobody's going to continue doing this. They're not going to pull this mess off every day. I got to come up with another idea. And I thought of Thaddeus back in Africa. And I thought, okay, we're just going to sprinkle that wound with charcoal powder, and it's going to help to dry it up faster than the poultice, because it was just turning into mush. And I knew that nobody was going to want to do that. So we just covered his legs in charcoal powder, the same thing. And it pretty well took care of the odor. This is day 3, and we took off that poultice bandage. And I think on this one, we were all crowded into that little room there at that complex. And I can't remember if we made a poultice or I think we put more powder on him. Yeah. And then I said goodbye, and I thought, you know, who's going to follow up on this? And if there weren't 2 women there who had followed up, we wouldn't be having this story. I seriously doubt that if they hadn't been willing to take this case on, Liz and Hermana, I don't know if we'd have this.
In fact, Hermana slept on the church floor for weeks, saying she's not going to leave until he's healed.
Yeah.
She's still working with him today.
Well, the story has gone much farther than Carrie now. So that was day 3. He's awake, and he's game. I'm game. Now this is just the year before. Carrie's in the intensive care unit. He's bleeding from all his wounds. And he's in a tremendous amount of pain. They did artificial skin grafts, staples, and he'd had it. I don't want any more. And his wounds were quite amazing. You know, they wanted to cut them off. That's a year ago. This is today. In fact, that was Thursday. That's Thursday. Can you remember what it looked like? Up to his knees. Now he says it's actually shorter than that. It's somewhere down in here, and that's all new tissue. And he says it's only a thin band now in the front. There's some swat. The left leg was worse for whatever reason. The left leg was worse. I don't know. Seemed to be more swollen. He can't put it down. Oh, and he's a big guy, and he could only walk. He could walk like this.
Being in the wheelchair for so long.
That's it. Now he can stand up. But he can't put his foot. He can't put his left foot down. It's still.
Straighten his legs all the way yet. We're still working on that.
But he has goals. There's so much to his story. It's it'll bring tears to you if I told you everything that's happened to him in 4 months. It's an amazing story. So there's Carrie 4 months ago up to his knees, and now it's just down at his ankles. And again, the power of charcoal. Maybe something else would have worked. Maybe cabbage leaves. I'm serious. Maybe cabbage leaves would have worked, but cabbage leaves after one day smell pretty bad. You know, they work, but have you ever smelled rotten cabbage? Oh, it's bad. Any questions? Yes.
So these poultices that you do, will they work for like breathing issues and lung issues? I have emphysema, COPD from smoking.
Okay.
Cigarettes.
Yeah.
And I was just wondering, would the charcoal, I mean, if I just slapped one on my back, would it draw out the toxin?
Yeah, I've done dozens and dozens of cessation programs over my lifetime, and especially one of the charcoal stop smoking program. You guys need to do a stop smoking program. You need to do a 5 days stop smoking program in the local community. That would be a tremendous outreach. Treatment of choice for me, and I was a smoker. For me, I know number one treatment is water. I know that from so many, hundreds and hundreds of people that we've worked with, I know the number one treatment is water. I'm not trying to evade your question. Water and getting off of coffee. Are you a coffee drinker?
In the morning, I drink.
Those are the two things you work on. I don't know how much you're smoking, but you're well on the road. You're more than halfway across the river. There is no sense to go back now. You're there. You're just that one Chicago football player. He was hooked to one cigarette a day, and he was so close. It only needed a few little ingredients. Drinking water, it seems like it's too simple, but one of the mechanisms that when you're leaving off drugs is that maybe you've heard about your blood is alkaline or it's acid, but research has shown that people who are getting off of whether it's nicotine or fentanyl or anything else like that, if the food you're eating is acid ash or alkaline ash, depending on the diet, your body will slough the toxin quickly or slowly. Now you'd think I want to be off of tobacco, right? I'd like to get this over with quickly, so I'm going to take the diet that would get this nicotine out of my tissue as fast as possible. That's not how it works. You can get it out as fast as you want, but you're going to be left with the craving. And so what the researchers found is if people will take a plant-based diet, they'll end up with an acid ash, or they call it an acid ash diet or a plant-based diet, that the body detoxes more slowly. So you're not bringing any more of that toxin into the body, but the body will detox very slowly, and you have no withdrawal symptoms because your blood level stays high enough with the nicotine coming out of the tissue. It's going into the blood. You're not experiencing any withdrawal symptoms. You feel you're not adding any more nicotine or fentanyl, but your body says, "Oh, I'm fine," because it's coming out of the tissue into the bloodstream. And so you're tapering off naturally. But if you take a alkaline ash diet, an animal-based diet, it causes the tissue to dump these poisons very, very quickly. And consequently, you end up having more withdrawal symptoms. I don't know how that, I don't understand all that chemistry, but these are these programs that we put on, these physicians were telling us this. Yep.
So charcoal has no role?
So back to charcoal, yes. I did these 5-day programs long before I knew about charcoal. Well, I knew about it, but I never thought about implementing it. But depending on the addiction, charcoal is a great way of mitigating some of the withdrawal symptoms, for sure. As for putting it on your, if once you make that last step, give your body time. Probably within a year, you'll clear up. You said COPD? And emphysema? You think we're amazed seeing Carrie? You will be even more amazed how your body will clean up. It's so dramatic. You can't see it right now because that's where you're sitting, but you will be surprised. 1 year, less than 1 year.
I'll reinforce that water also helped me with my asthma. I've had asthma.
Oh yeah.
10 years ago, I started taking 2 quarts of water when I jump out of bed.
There you go.
It just went away.
So again, we don't want to place all the Are you have to take off?
Yeah, I do.
Okay. Well, hopefully we'll see you tomorrow then.
You'll see me tomorrow. I'll
Okay.
pick up Carrie too. And
Yeah.
make him bring
Okay.
James and
Tell him we missed him, and if he can make it, we'll look forward to seeing
touch
him.
with you this evening.
Okay. Good night. So, again, Becky, you've been learning a lot of things. You're a lot farther across the river. No sense going back now. And water, caffeine, plant-based foods. There's a lot of other tricks that people use in these programs, and I'm not depreciating them, but we have placed charcoal poultices on people with pericarditis. Did I pronounce that correctly? We put it on their chests, and in the morning there's this green gunk. Just like that poultice over the kidneys, there's this green gunk. Now, I can't explain the physics of that, but nevertheless, decongest these lungs that have been, oh, by the way, what does ITIS mean? What? Okay, so when you see a word that ends in ITIS, it means what? Inflammation. So what about pericarditis? It's inflammation of the sac around the heart. Or you have cellulitis. And so that's an infection of a layer right underneath the skin becomes inflamed. Or you have appendicitis or arthritis or any other number of macular degenerative diseases that end in itis. They all respond to charcoal amazingly well. So in your case, with COPD is another animal, but it will respond to water. Your lungs need water, and they've been dried out from years of exposure to nicotine, smoking. So they need to be rehydrated. It's not going to happen overnight. But you should expect, not just from Michael's testimony, but you should expect that God will bless that. You know, the beginning of the Bible starts with water, right? What does the Bible end with? Take the water of life, what? Freely. So Jesus begins the Bible, and ends the Bible by saying, you know, we are water-based. Drink water. I'm not saying you can't use charcoal, but
Well, I use charcoal anyway, so, but
there you go.
thank you.
Yes. Any other questions? Yes.
You mentioned the itis is, arthritis is something that everybody I know has. Charcoal poultices? Or what do you, is it in your book?
Well, it's in the book, and one of the doctors at Uchee Pines said, I asked him, well, what do you use charcoal for? He said, arthritis. He said, don't ask me how it works. I have no idea what's happening there. All I know is it works. And this thing called Pain Patch was developed in South Korea, and we were introduced to it by a Marine jump instructor out in California. So he was a jump instructor, and you can imagine hitting the impact of hitting the ground day in, day out, weekend. After a while, he had a lot of lower back pain, right? He said this is complete relief from the pain. It's a very simple product. You can make your own poultice, but
That's what we have to do. But is it a cure? Does it cure or does it?
no, in this case, whatever is triggering the pain,
Yeah.
charcoal is dealing with that trigger. I read one orthopedic surgeon said, as far as these kind of diseases, he says, work through it. Don't give in to it. Work through these discomforts. As far as he was concerned, there was no magic cure. I think, yes, your lifestyle is going to have an influence on that. I think if you have arthritis in the lower limbs, check your blood circulation. Are your feet cold? That sounds a little bit too simplified, but check the temperature of your feet. If your feet are cold, that means your legs aren't getting enough blood and oxygen, and the life is in the blood. Healing is in the blood. So I look for the most simple possible solutions first, and then if they don't work, then okay, what else could we try? Hot and cold soaks. So I would have the person put it in and we're going to show some hot and cold soaks tomorrow. But we contrast baths, hot for 3 to 5 minutes, and then over to cold. Kerry is doing it. He is making his own poultices now. He makes his own. He's offering to make poultices for free for other people. Now we're getting him some tools, and he's going to start a small appliance repair business. So if you're in Asheville, look up Kerry. If you have any lamps that are not working or space heaters that aren't working, this guy was a master electrician. He had an electrical company with 60 employees. He was financially, he lost everything. God had to bring him down. He had to bring him down. So now, if you cast your cares upon the Lord, what will He do? He'll lift you up.
If we can be humbled, we can be exalted.
Yes. And this man is amazing. When they were talking to us the other night of how this all came about, it was just amazing. Any more questions? I'm going to just show a few more pictures and then we're going to close off for this evening. Where are we here? Oh, the eyes. We learned this idea from a woman from Korea, and this is basically a very simple version of an iPad, and in it has a granular charcoal, and it works. Ellen White said, don't put anything in the eye, because the eye is such a sensitive organ. Don't put anything in it. But the one thing she did say about eyes was make a charcoal poultice for her eyes. She was older, and she was coming out of the house, and she fell forward onto a steel plate. She fell full force, all her body weight forward onto this steel plate, caught her here, and she said she was in excruciating pain. And the only thing that worked was charcoal poultice. So this, based on that experience, Kimberly's made these very simple iPads. Did you catch that one?
Yes.
Where you plug it in?
Sounds like a way better iPad. Yes.
And Apple has nothing on us. People with macular degeneration who can't see their hand in front of their face, after a period of time can read. That lady came to us on the internet, and she said, I can't see. Somebody told me about you. I found you, I guess on the internet. And the person at our business who answered the phone said, well, you need to try these product. And she sent her some free, and she serious macular degeneration. And after a period of time, she was able to read again. Obviously not perfect vision, right? She's an elderly woman, so she had all those things going. But she said, I prayed that God would lead me to a remedy. And of all the remedies, God led her to us. There was one young woman who had pars planitis, ocular inflammatory disease. Now that's a tongue twister. But pars, what? Planitis. An inflammation. And that's where poison of inflammation. You say, oh, okay. So I connect the dots. I know nothing about pars planitis. Well, we have a doctor friend, John Clark, who is an orthopedic surgeon. He's left his practice and gone to natural medicine. Got tired of cutting off body parts for a living, and he became an instructor. And this woman contacted him. The girl went into a specialist in Boston for eye disease. He diagnosed her and said, we have to put you on steroids. And the mother was a nurse, or we have to give you chemo. Either way, you're probably going to go blind. And her mother says, after the visit, the mother said, wait a minute. Let's get a second or third opinion on this one. Called Dr. John. Dr. John said, I want you to drink lots of water. That's the first thing he said to her. I want you to drink more water. Then I want you to go on a plant-based diet. And third thing, I want you to start making charcoal poultices. And she recovered. Of course, it's a charcoal story. But she went back for an exam, and she went in and talked to the specialist, and you know what he said? The beast is gone. And she said, well, you know what I did? He wasn't the least bit interested in what she did. He just kind of waved her off. And he said, well, you used the prescription for chemo that I gave you. No, I still have it here. I've never used it. Thank you. Wasn't interested. And her story has helped a lot of people, I'll tell you. And your story or Carrie's story can help a lot of people. And it has helped a lot of people. And her eyes got so good that it became so white, the whites of her eyes. People were saying, what are you doing? She said, well, I'm just using this charcoal poultices. And she said, one of the first things I noticed was that all the lights, when I looked at lights, they didn't have halos around them. She thought halos around lights were normal. So everybody looks up at the lights. And I can see a halo. My eyes are getting a little bit old. But this was a young mother. The last thing she wanted was go blind. She had kids. No more halos.
You need to put a charcoal eye.
I knew you were going to say that. My wife does. She has them conveniently hanging in different places, so I see them. Yes, and they work. They do. I'm on a computer way too much, and so my eyes are really inflamed, and they just ache. And she'll say, "See that chair? Lay in it." And over she comes with a hot one of these, and she lays it on it. And I have to confess, it feels much better. It's just, I'm a man.
Yeah, you need a wife to take care of you that tells you what you need. Would that prevent cataract surgery?
We've had these stories when I was in the UK. The woman had actually, she was recovering from cataract surgery, and she used charcoal poultices. Kimberly will tell you, you can, but charcoal has this ability to pull things out of the flesh. Broken glass, 2-inch thorns, broken bones. I've seen broken bones come out of the flesh that have been there for quite a while. So Kimberly kind of extrapolates that and says, you know, if you have cataract surgery, the last thing I want is it to pull the lens out. So,
Now, before, will it prevent cataract surgery?
so we covered that area. I'm not sure that it would, but
Yeah, okay.
who wants to find out, right?